Sutures and needles are essential tools in surgery. They are used to close wounds and incisions. This helps to promote healing and prevent infection. Sutures are strands of material used to stitch tissues together. Needles are used to guide the suture through the tissue. The choice of suture and needle depends on the type of surgery. It also depends on the location of the wound. The surgeon's preference is also a factor. Proper suturing technique is crucial for optimal wound healing. It also minimizes scarring and prevents complications. Sutures and needles play a vital role in patient safety. They are used in almost all surgical procedures. Understanding their importance is fundamental for all perioperative healthcare professionals. This is especially true for nursing students entering this field. There are two main types of sutures, absorbable and non-absorbable. Absorbable sutures are broken down by the body over time. Non-absorbable sutures remain in the body permanently. They need to be removed later. Absorbable sutures are commonly used for internal tissues. Non-absorbable sutures are used for external wounds or tissues requiring long-term support. Examples of absorbable sutures include Vicryl and monocryl. Examples of non-absorbable sutures include nylon and Prolene. Needles also come in various shapes and sizes. This includes cutting needles for tough tissues. Round needles are for softer tissues. The choice of needle depends on the tissue being sutured and the surgeon's preference. Understanding the different types of sutures and needles is important. It allows healthcare professionals to choose the right materials for each procedure. This knowledge is crucial for perioperative nursing students. It prepares them to assist surgeons effectively during surgery. Wound suturing is a multi-step procedure that requires precision and care. The first step is to clean and disinfect the wound. This removes any debris or bacteria. Next, a local anesthetic is injected around the wound. This numbs the area and minimizes pain for the patient. Once the area is numb, the surgeon carefully brings the edges of the wound together. They use a needle driver to pass the suture through the tissue. The suture is then tied securely to close the wound. The number of sutures used depends on the size and depth of the wound. Once the suturing is complete, the wound is cleaned again. A sterile dressing is applied to protect the wound and promote healing. Proper wound care instructions are given to the patient to prevent infection and ensure optimal healing. Perioperative nursing students need specific skills and knowledge related to sutures and needles. They need to know how to prepare suture materials. They also need to know how to assist the surgeon during suturing. This includes passing instruments and maintaining a sterile field. Students need to understand the principles of wound healing. They need to know how to recognize and manage potential complications. This includes infection, bleeding, and wound dehiscence. Furthermore, students should be knowledgeable about different suturing techniques. They should be aware of the various types of sutures and needles. They should also know the appropriate selection and usage for different surgical procedures. This comprehensive knowledge is crucial for perioperative nurses to ensure patient safety and positive surgical outcomes.